Hello, my name is Dr. Jeffrey Esper. I'm the UPMC Hamot Neurology Residency Program Director. We are a fully accredited ACGME neurology residency program here in Erie, Pennsylvania. Our city is about 100,000 people, but our referral area is close to 1 million patients. This allows a broad experience to a variety of pathologies in peoples of different ethnicities and backgrounds. Our institution is the Regional Trauma Center, as well as the only comprehensive stroke center in the area. We have received the highest quality metric marks for stroke care from U.S. News and World Report 3 years in a row. We have a complement of 9 residents in our program. The residency is designed to provide a well-rounded training experience to each of our candidates. Our first-time board pass rate is 100%. Our residents have gone into private general neurology practice as well as subspecialty fellowships and have done very well. I would like to have some of the faculty as well as our residents introduce you to the different aspects of our program.
In my clinic, which is an outpatient-based clinic, I see patients regularly during the week. I have the opportunity to work with a lot of the residents during an elective rotation month that often is set up by the residents. In that time, the residents work very closely with me, seeing these patients, and we see the patients and diagnose patients, come up with treatment plans. We have a lot of hands-on opportunity with the residents as well in my clinic to see patients and treat certain conditions that involve botulinum toxin injections for different muscular conditions, treating dystonia, treating migraine headaches, treating drooling with Parkinson's disease, treating spasticity from strokes. The degree of hands-on training at the resident level probably is equal to some places' fellowship programs. And in fact, prior residents that have gone through the rotation with me have applied for movement disorder fellowship, and they were comfortable to start their movement disorder fellowship at the level of seasoned fellows.
We have a pretty nice, tight-knit resident group. We're like a little family, and I think that kind of reflects how Erie is as a whole. It's a pretty tight-knit community. We have really nice 4 seasons. We do get a lot of snow in winter, but we even have our own little ski resort. They have skiing and tubing, so those are some fun things to do. As far as summer times and springs and falls, we have a lot of nice places to go. We have Asbury Woods, which is a popular place to hike. We have the Peninsula, which is pretty renowned for the area. There's things to do there, boating, water skiing, swimming. If you end up here, I think you'll be happy with your decision. It's a very beautiful place with lots of outdoor activities and wonderful people to work with and just nice people overall.
This hospital is the only comprehensive stroke center that covers a population of about 1 million people. And starting our intern year, we actually get an opportunity to be able to run stroke alerts with a good amount of supervision to make sure we are learning. And by the time I became a second year, I felt comfortable running these stroke alerts independently. Starting our second year, when we were doing our inpatient service, we have a lot of opportunities to get exposure to a wide variety of acute neurological pathologies. We have the opportunity to manage the epilepsy monitoring unit, and of course we have a lot of opportunities to practice our skills with lumbar punctures. In our outpatient clinics, we have a lot of opportunities to learn about how to use a VNS, injecting Botox, managing complex patients, and a lot more.
One of the things I like about our program is that we have great support for research. Whether you come to our program with extensive research experience or without any, you will find opportunities and people that will help make the process easier. If you're interested, we can help you from developing the project to writing it to finding a good journal for publication. Dr. Bianchi is our Director of Medical Research Operations, and she really takes one-on-one approach with residents to help them guide through this sometimes daunting process and provides her experienced input. During my residency, I authored peer-reviewed articles and participated in group research academic activities.
With 3 months of inpatient neurology in your first year, you'll get to dive into practical and career-building training from day one. Many of the attendings on this service graduated from this very residency, and these attendings pride themselves on their commitment to patient care and evidence-based medicine. While on the neurology service, our days typically include table rounds followed by teaching rounds with the attendings and the whole team. There's plenty of opportunity for you to develop your own clinical judgment, clinical skills, and treatments for your patients with supervision from the attendings.
One reason that the residency is very important and sort of near and dear to me is because I graduated from the residency program in 2015. I then came on as one of the neurohospitalist attendings. With that transition from this residency program to being an attending, without having any sort of fellowship training, I was able to start my job running actually on July 3rd, so 2 days after I graduated, with all the knowledge that I needed to be a successful and knowledgeable attending. I think that's one of the best parts about this residency, is that you get every angle of neurology and you get enough of it so that if you want to go to a fellowship, then you can go anywhere you want. If you don't want to do a fellowship and want to go into practice, then you have the knowledge base learned from the pathology that we see and from the other faculty to hang your own shingle and be able to get out there and do your job. Also, I had a choice to go anywhere, and I chose to stay at UPMC Hamot to be an attending because I love the atmosphere, I love the hospital, I like teaching with residents, and it's just a great work environment that I was proud to be a part of enough to stay on now and probably for a long time out from here.
Part of the reason I liked my training here at UPMC Hamot is that the attendings were so happy to teach us, and they were more than happy to sort of take time out of their day in busy schedules to make sure that we had a good understanding of what we were asked to learn. My role has been to teach epilepsy, electroencephalography, and clinical neurophysiology to the residents. And part of their role with us, or with me, is to walk through the different clinical treatment approach to epilepsy patients. We spend a few months together learning how to read electroencephalograms or EEG studies. And we also do some basic neurophysiology to make sure that you understand things like brainstem evoked potentials and visually evoked potentials. Not only do I teach the technical type of component, but we also work together to treat epilepsy patients in clinic. Some of the parts that set us sort of apart from other facilities, I'd like to say, is the sort of close-knit nature that you'll have between the different attendings. We have a very significant degree of camaraderie, and I think the degree of collegial activity that you'll see between us, or attitudes we have between each other, is palpable. It's nice to have a facility that not only appreciates you being there, but also is sort of emotionally invested in your development as a physician. And I think that really sort of resonates with a lot of people. I am initially from Erie and ultimately decided to come back here because of such a wonderful environment that they have created for us to work.
When I was looking for a program to get into, I really wanted one that felt more like a family. A lot of people I know chose on location and things like that, but I was really more centered on the people itself. I needed a home away from home, basically. So choosing this program, the residents here were already great. They treated each other like family members. We try to be very supportive. There isn't really any competition with each other. We really want to just try to make sure that everyone is doing the best that they possibly can be. And that translates even into the interactions with our attendings. I mean, as interns, you are already interacting with your attending. They already know you on a first name basis. And that's even true as you go through with your daily lectures that you still have with the neurology program and the call that you take on the weekend. So you're integrated into the neurology program even as an intern, which it makes it even easier when you become into your second year, which is supposed to be your hardest year for your neurology program, for your residency. Doing more things on your own, taking night call, things like that, it already is great because you have this relationship with the attendings. They already know who you are, so they give you so much more autonomy, which is the reason why this was one of the only places that I would ever choose to go.
If you have any questions with regards to the residency, please don't hesitate to call our residency coordinator at 814-877-4178. Thank you for your attention.